Hi, I'm Natalia, the practice administrator here at the Center for Developmental Psychiatry, and today I am excited to introduce you to one of our psychiatrists, Dr. Keeva Madden. She brings extensive expertise and a compassionate approach to working with her patients, helping them feel understood and empowered in their mental health journey. So today we'll get to know more about her background, the types of patients she specializes in, and her unique approach to care. So, Dr. Madden, thank you for joining me. And to start, can you tell us a little bit about your journey into psychiatry and what inspires your work?
Sure. Yeah. Yeah. It's a long journey, but I guess essentially I've always been interested in health and psychology. And I entered college kind of hoping to pursue at least one of those avenues. And I ultimately decided on medicine because I feel like it offered a way to help people in a way that kind of resonated with me. And so I've always been drawn to understanding emotions and experience of people, particularly when they face challenges that feel too big for them to carry alone, and just how can I be helpful in that situation? And so psychiatry felt like the right fit for me to do that.
And what area of psychiatry do you specialize in?
So I mainly work with the child and adolescent population from as young as 2 years old to like a transitional age into college years. I do work with adults as well, but most of my work is in the child and adolescent world. For the child and adolescent population specifically, the idea of working with kids at such a critical age in their development is meaningful to me because I feel like early intervention can change the trajectory of their lives. I also want to be someone who provides not only clinical expertise, but also a safe space for the individual to express themselves, feel validated, and build resilience in difficult moments. And that just goes for patients of all ages.
Kate, and can you tell me what you enjoy most about working with patients?
Oh, yeah, good question. I love learning about what people are passionate about and how we can work together to nurture that essentially. I also love working with youth and kind of problem solving in their world.
Great. And can you describe your approach to treatment and how you collaborate with other professionals like therapists, pediatricians, and schools?
So I try to take a holistic approach to patient care and try to consider other areas of their life and well-being that can maybe be like better optimized. And so that could look like, how can we improve their sleep and sleep hygiene? What does their diet look like? Are they physically active? What's their community, extracurricular involvement, getting outside, that sort of thing. I also offer medication options when appropriate and love working with patients and families using therapy as well. So my style typically involves a mix of all of the above. In terms of collaboration, I do feel like no child is an island and that it takes a village. So I like to collaborate with their village as much as possible. I set up calls. I message families, therapists, school support, coaches, any people in their life who's important, who could help me support them in the best way possible.
Okay, and how do you tailor treatment plans to fit the unique needs of each patient?
So it starts with hearing about the individual and their challenges as well as their goals. I can help bridge the gap by offering what would be helpful for them now and in the long run, including medication and therapy. I also like to be a resource in offering referrals or maybe other services that can support them or maybe can address things that are going on that are maybe out of my scope.
When we're talking about working with your patients, what should a new patient expect with their first session with you?
So I like to think that I offer an open and supportive space to talk about what has brought the individual or the family, sometimes it's the family, to speaking to me, a specialist. I try to reiterate what to expect and try to determine the family's goals or individual goals in the whole intake process. So is it they're looking for therapy? Is it a specific diagnosis? Is it medication? I generally don't offer a treatment plan and recommendations right away until I've heard from as many people as possible. And so typically I offer that by the final feedback session of the intake sessions.
And how do you help patients feel comfortable about opening up about their mental health?
That's a good one. Yeah. I just try to talk to the individual about their life up front. Again, I'm just interested about who they are, how they move through the world. I try to ask about their interests, their hobbies, what is school like for them, their friends and family, what's been going well for them lately, maybe what hasn't been going as well, what are the rooms for improvement, so to speak. And so these are usually good openers that lead to more deeper discussions about mental health, well-being, and that sort of thing.
What if in a situation a child is refusing to participate in a session?
That's a good question. I try to offer for the parent, guardian, or maybe even school support to be there in with the individual. If it's a kid, so that they can support them. Sometimes it requires rescheduling to accommodate schedules. Yeah, just try as much as possible to meet the kid where they're at so that they feel comfortable.
What do you wish more people knew about psychiatric care?
Yeah, no, that's a really good question. So I like to see myself as as a psychiatrist, as just another team member on, your life team, the kiddo's life team. As psychiatrists, we can offer medication in addition to therapy. And medication specifically, I like to think as being just another tool in your toolbox, which can help you feel most like yourself.
How do you decide when medication is the right choice for a patient?
So there is no right or wrong choice, but what makes sense for you based on where you are in life. That is to say, there are things to consider about that decision, such as, how much are the individual symptoms impacting them, and how much can medication reduce the impact of these symptoms on the person's life and well-being. I like to think about it in that way.
What if parents don't feel ready to start medication once they completed their evaluation?
So I try to, again, meet them where they're at and get a sense of, what are their thoughts about medication in general? Like, what have they heard? If we're talking about specific types of medication based on their child's presentation, have they heard about those medications? So I just try to enter the space with getting an understanding of their understanding and going from there. If at the end of it, they are still unsure, I always encourage them to take time and think about, what medication would mean. If they have any more questions, I always encourage them to reach out. And I still encourage, even a follow up with me, with them and their child, just so I can check in about symptoms, check in with them to see how they're feeling about medications, if they have any further thoughts or concerns. Essentially, I just want them to feel comfortable.
And how long does a child typically need to be on medication?
So this is a great question, and I get it a lot because I like to think that being on medication isn't a life sentence. So ideally, I like to see the individual stable on the medication for about a year. So, no worsening of symptoms, no breakthrough symptoms, stable on a medication dose. And then we can start talking about, okay, maybe we can start pulling back on the medication to see if their symptoms remain stable.
After the intake session, how frequent are follow-ups?
So generally, I like to check in with patients within 2 to 4 weeks after the intake, especially if we have started a medication. I want to check in to make sure that there are no side effects, and to see if it's effective. If we are starting like therapy, then at least every 2 weeks, to start.
But what's one book, podcast, or resource you'd recommend for mental wellness?
Yeah, that's a really great question. So I'm actually a big TV and movie watcher. I like to consume a lot of media that way. And I really feel like a lot can be conveyed through TV and television and movies. So I would say in order to have a conversation about emotions, which I feel like is a common theme that comes up in my work with families, is, how do I get my child just to talk about their emotions and how they're feeling? I always recommend the movies Inside Out and Inside Out 2. Those are a really great starting point, to watch as a family and then maybe have a discussion afterwards about feelings.
Okay, great. And what's the best piece of advice you've ever received?
Oh, yeah. The best piece of advice I ever received, probably be you can get far with a kind word and a sympathetic ear.
Beautiful. And these are going to be just some practice specific questions here. I want to know,
Okay.
why did you choose to work for the Center for Developmental Psychiatry? What drew you in?
What drew me into working for the Center of Developmental Psychiatry is, for me, the practice allow me to work with patients and families in a way that works best for me. And I feel like it has translated well in my work with my patients. So I'm allowed to be with patients for longer periods. Average session length is 30 to 45 minutes, which allows me to really understand their issues, concerns, and provide the best plan to move forward. So that's part of the reason why. There's also a really great work culture here. The owner, Dr. Jason Dean, really emphasizes work-life balance, which definitely benefits me in my work as well.
What would you say makes this practice different than others?
Yeah. So what makes us different is all of our clinicians are able to offer both medication as well as therapy as options for treatment. And we also have the benefit of being able to spend more time with our patients as our visits are between 30 to 45 minutes in length.
How can patients or families get the most out of their care with you?
So I like to think I'm fairly accessible, which I think families appreciate. I like to keep open lines of communication between myself and families as much as possible so that patients feel supported even between visits.
Thank you so much for joining me, Dr. Madden. And I'm sure we'll
Thank you, Natalia.
all
Sorry.
right. Take care.
Thank you.